Republican Senator John Barrasso of Wyoming joins us now. He's chairman of the Senate Republican Policy Committee. Also, we should mention, and like to, Dr. Barrasso, an orthopedic surgeon, so it's nice to talk to him about health care issues. Senator, what do you make of this reversal now?
Well, I think, Jenna, that they are panicked in the White House. They set a number out there of 7 million people insured through the health care program and the law. They are woefully behind that, and they're panicked and want to just try to get the numbers up any way that they can. We're still trying to find out how many people actually have insurance, not just have gone to the website, which is what the White House is counting, but actually how many paid for the insurance. And of those that are paying, how many didn't have insurance beforehand? Because after all, the president said he wanted to get 30 million Americans who didn't have insurance to get insurance. They haven't even been counting that, but it looks like there may be fewer than 2 million Americans.
Well, and quite
after
frankly,
all of this spending and all of these things.
We actually don't know the numbers yet, right? I mean, that's one of the issues that we're having, is that we don't actually have accurate numbers in some of the things that you're asking. Senator, as a doctor as well as a lawmaker, what about this question? You know, we get extensions when we need to, if we need an extension to file our taxes. Should people have more time if they need to shop appropriately for insurance? What's the risk of that?
Well, this is just one of about 25 different changes the president has unilaterally made to the health care law. And all you have to do is ask, and it's on the honor system. You know, it's like I said, give me an A in my test, and I'm sure I may have or not handed in the paper. The president continues to make Swiss cheese out of this law. And the other question to all of this is, what kind of insurance do people have in terms of what kind of coverage do they get if they actually go through this healthcare website and buy insurance? And what we're finding is that many people are not able to keep their doctor, can't get the kind of care they want, and specifically for cancer patients, the Associated Press is telling us that only 4 of 19 major cancer centers in the country are going to be covered by all of the programs that you can buy insurance for on the exchanges. So the president makes promises, but he's not keeping any of, keeping very few of them.
Looking forward, this extension would give people, again, on the honor system, as you point out, until about mid-April to make their final choice about health care. Is there anything within your power in the Senate or within Congress in general to stop that extension from going from mid-April to, let's say, mid-May, or maybe going until November when there's an election?
Yeah, that's the key thing about all of this, Jenna. I think that the president and the Democrats are panicked by what's happening. There is so much opposition to the health care law. The president said the website would be as easy as to use as Amazon, cheaper than your cell phone bill. You could keep your doctor. People aren't finding the president's statements to be true. He wants to continue to push pain associated with this law beyond the November elections.
And there's nothing you could do to stop that?
Well, there are lawsuits being filed on different parts of the health care law. The Supreme Court visited yesterday about one of those specific cases, and there were arguments there.
Wow.
So that's the route to go.
Okay.
The American people are seeing that they're not signing up for the health care law, and the administration is desperate to try to find a way. They talked about there was going to be a mad rush. The administration is mad because there's no rush to sign up for health care.
Quite frankly, we don't have the numbers, so we don't know that. We'll continue to watch those legal challenges, as you mentioned, which is the path that you say has to be taken to try to challenge this law. Just real briefly here, you just wrote an op-ed at foxnews.com. And one of the things that you said is that Republicans do believe in reform when it comes to the health care system. When will America see a comprehensive Republican plan for that reform?
Republicans don't believe that the answer is a 2,700-page law. We know that those are full of problems and unintended consequences, which is the problem of this health care law. We need to go step by step in the right direction to make sure that people with pre-existing conditions are covered. We need to make sure that young people can stay on their parents' plans. We want people to be able to get more bang for the buck, shopping across state lines, leveling the playing field from a tax standpoint. There are specific things that we can do, but this 2,700-page law has been fraught with a disaster for the country.
Well, we look forward again to seeing a comprehensive plan, and whether or not that's presented by the GOP before November is a big question. So we'd love to have you back to talk about that, Senator Barrasso.
Thanks, Jenna.
Thank you so much for the time today.
Thanks for having me.